Welcome back. You know, that was Nurse Barb, and we just talked about cancer screenings, but lucky us, we have Dr. Rodney Hill and Cynthia Daniels with Associates in Women's Health in Mahoning Valley, who is going to talk with us even more in depth about what we just talked about, a serious subject, cervical cancer. Good morning, Cynthia. Good morning, Dr. Hill.
Good morning to you, Madonna.
I'm so glad that both of you are here. Hill. I'm glad that you're Hill too.
I'm a Hill.
I'm a Hill. You're a Hill. Well, I want to know how important, Dr. Hill, is that gynecological exam?
The annual gynecological exam is important, as with any yearly well visit.
Okay.
It's important because you can find STDs, discharges, depending on your age group, 21 and above, you're having a pap smear done. So you can find, are there any precancerous changes? You get to evaluate the uterus and both ovaries. Are there any ovarian masses?
Okay.
So you will identify them. Also, along with the pelvic exam is the annual breast exam.
Okay. When we were talking earlier, now the pelvic exam, pap smear, HPV, those are three completely different things, aren't they? That can be a part of the entire visit.
Correct.
Explain that to my viewers.
Okay. When you come in for your well woman visit, pap smear is just one particular test that is done at the time of the pelvic examination. Depending on your age, you may be checked for STDs. Okay.
Okay.
And afterwards, you may get blood tests done for HIV, syphilis, and hepatitis.
Okay. All right. As a nurse practitioner, Cynthia Daniels, I want to know, you've been in Dr. Hill's practice, and I had the opportunity to meet you there.
Yes.
And I think that you're very professional, and I enjoyed meeting you, and I enjoyed having dialogue with you. As a nurse practitioner, how do you work with Dr. Hill?
Well, we're kind of like a tag team.
All right.
I usually do all of the women's vaginal examinations, pap smears, the STD exams, breast examinations, a lot of education. I think education is vital. If you don't know, then you don't know. And so we want women to be informed, teaching them how important it is to examine their breasts, how important it is to come in and have those examinations, the pelvic exam. When do you have the pap smear? When do you have, when are you tested for the HPV?
Okay. Well, let's talk about that HPV. Dr. Hill, Cynthia, I understand now there's a vaccination that young folks are given for HPV.
Correct.
What is HPV? Say it. What is it?
HPV stands for human papillomavirus.
Okay. How is that transmitted, sir?
That is transmitted via sexual contact.
Now, there's something that, I've read and I've seen that people can younger folks get these vaccinations. Does that
Correct.
prevent or does that help? I mean, what does the vaccination do? Eliminate?
What the vaccination does, it protects against the three most common subtypes of human papillomavirus. There are maybe 50 to 100 different subtypes.
Wow.
But
Okay.
only 3 of those subtypes cause 90% of cervical cancers.
Okay.
So then theoretically, if you can eliminate those 3 subtypes, your chances of getting precancerous changes of your cervix and potentially cervical cancer is gone, or at least diminished tremendously.
A great amount. Are there symptoms, signs of cervical cancer?
Are there signs of cervical cancer? The answer to that is, generally speaking, no.
Okay.
Now,
Scary.
when there are signs, that usually means it's too late.
Oh, Dr. Hill, I see Cynthia nodding her head, but that is the purpose of getting an annual examination.
Correct.
That's, I think, where we forget as women, and even if I can, take a step out on faith and say within the minority community, sometimes we don't. We say, oh, I'll pass on that, or
I'll tell you the other, I guess, misnomer,
please.
where a pap smear is done.
What do you mean?
What do I mean? Well, let's say a young lady goes to the emergency room for a complaint of pelvic pain or discharge of some sort. and a pelvic exam is done in the emergency room, it's not uncommon that that young lady is under the assumption that she's had a pap smear done. So let's
Two
say
different things.
she comes to me as a new patient, and the first thing we ask, when was your last pap smear done? And she'll say 3 months ago, or 6 months ago, or a year ago. So the next follow-up question, where was that pap smear done? If the young lady says at the urgent care or at the emergency room, then I know that was not a pap smear. Now, of course, it's not unusual to get blowback. Well, yes, it was. So then I have to explain, no, that was a pelvic exam. What they did, they checked for discharges, they checked for sexually transmitted diseases, but they did not do a pap smear. And the reasons are many why they don't do pap smears in emergency rooms. Number one, it's very hard to follow up on individuals who come to the emergency room for various reasons. One is sometimes people come under false names.
Yeah.
Number
You
two,
know it.
sometimes people come in using a card that's not their own, an insurance card that's not their own.
Yeah. And
Or they give
that's bad.
fake addresses or fake phone numbers.
Just to be able to get the service.
And the reason is obvious. If you don't have the resources to pay for that visit, then the bill will never get to you.
One thing that I can say, and I know this to be true at your practice, that you are a very open for folks that don't have insurance. I mean, you like to make sure that everybody is healthy.
Oh, definitely.
And if somebody has a situation, you will bring them in and see them, now won't you?
Yes, I will.
I know it. I know. Now, this is no reason for y'all to go on out and say, oh, let's go make an appointment at Dr. Hill, but maybe it is. You know, if you don't have insurance and you're experiencing problems, this is the key time to come in.
Oh, definitely.
Cynthia, I want to get you in this interview for sure because you represent the female aspect. What made you get into nurse practitioning? Or is that the right term?
It's nurse practitioner.
What made you get into it?
Well, I've always wanted to be a nurse, and so after moving from being at the bedside, I went into education, and so I teach at Youngstown State University. So I'm one of the nursing instructors. I love education, and the opportunity came up for me to go into a nurse practitioner program, and so
and here you are.
and I love it.
And you've partnered with one of the best. Dr. Rodney Hill
certainly
is
believe
awesome.
that. Yeah.
You know, and I'm saying that because, you know, of course he's my physician, but he is awesome. And Dr. Hill, there are so many times that, you know, when I come in and I talk to you, you've got so many wonderful ideas for this community. We need to capitalize on you more than what we do.
And I agree.
Yes.
definitely agree.
Because education is key.
You know, education is power. You know, education is power because a lot of times things happen because you're not aware. You don't know. And when you don't know, sometimes you can be taken advantage of, or you can agree to things that are not in your best interest.
Well, Dr. Hill, Cynthia Daniels, thank you so much for taking the time to come here to WFMJ and help us celebrate Cervical Cancer Awareness Month, but to get people informed and educated. I'm glad you
Sure.
both made a visit here.
Thank
Great.
you.
And let's not make it the last time. There's Dr. Hill's information, everybody, with the phone number. Make sure that you give him a call and make your appointment. Get involved and get educated. That's what's key. Dr. Hill, Cynthia, thank you.
You know, also let them know that they could email me.
Oh, yes. We've got the email information on our
Okay,
website as
great.
well. Yes, thank
And
you,
you
Dr.
will
Hill.
get a response within 24 hours.
Well, how about that? Dr. Hill is on it. I love it. Well, thank you both.
Sure, my pleasure.
Thank you. We're going to take a quick break and we're going to come back with the Oh Wow moment. Back in one moment.